So this video will help you to deal with or to know the difference between osteochondroma, chondrosarcoma, and diaphyseal aclasis. So the term bony exostosis is the same term of cartilage-capped exostosis, cartilage-capped bony exostosis. Okay, so this is an example of cartilage-capped bony exostosis. How to comment? A well-defined bony exostosis. Okay, a scene originating from the medial cortex. This is the medial cortex, okay, of the of the proximal phalanx of the left middle finger. So you need to comment on the cortex which the lesion is in continuity with or arising from. Then you need to comment that the lesion doesn't show any destructive changes itself. The lesion itself doesn't show any destructive changes or any extraosseous soft tissue component. This is very important to exclude that the lesion developed malignant transformation. Okay, no pathological fracture. You need to comment on if there is evidence of pathological fracture because it affects the line of treatment. So no pathological fracture, appearance in keeping with or suggestive of cartilage-capped bony exostosis or osteochondroma. This is a benign lesion. I wouldn't recommend any further test or workup if the patient is asymptomatic. If the patient is asymptomatic, I wouldn't recommend anything. However, if the patient is symptomatic, you need to deal with the symptomatic patient in two ways. These symptoms could be due to osteomyelitis or infarction of the lesion. And the symptoms also can be due to compressive effect of the lesion on the adjacent nerves or vessels. So I would recommend an MRI to exclude osteomyelitis or infarction development of the lesion as a complication. And I would recommend also orthopedic referral for surgical excision, as this pain could be due to nerve or vascular compression. Okay, let's see the next case of bony exostosis. This is the next case of bony exostosis. This case is different because it's bilateral and multiple lesions. It's not single lesion here. So the diagnosis is different. Yeah, they are, all of these lesions are bony exostosis. As you can see here, but this is hereditary multiple. This is the diagnosis here is diaphyseal aclasis or multiple hereditary exostosis. You can say multiple hereditary exostosis or multiple hereditary osteochondroma. It's not enchondroma. Osteochondroma or diaphyseal aclasis. Okay, so what can I see here? Bilateral multiple areas of bony exostosis are seen arising from both iliac wings, as well as both femoral lesser trochanters, The lesions doesn't show any evidence of destructive changes or extraosseous soft tissue mass. The appearance is suggestive of multiple hereditary exostosis or osteochondromas or diaphyseal aclasis. This is an autosomal dominant disease. Diaphyseal aclasis, you need to know that diaphyseal aclasis is an autosomal dominant disease. This is a non-neoplastic. This is a non-neoplastic process, okay? But the patient is usually symptomatic. These multiple bilateral exostosis, of course, will make the patient symptomatic. The patient is usually symptomatic and requires orthopedic surgery referral for symptomatic treatment of the compressive symptoms of the lesions. Okay, let's see the next case. The next case is also bony exostosis. There are bilateral and multiple of bony exostosis. Where? Here. Bilateral, multiple areas of bony exostosis are seen arising from the distal aspects of both ulna and radius, distal aspects of both ulna and radius, with associated bending and shortening of both ulna. Okay, the lesions doesn't show any evidence of destructive changes or extraosseous of tissue component. Okay, the appearance is suggestive of multiple bilateral, multiple hereditary exostosis or diaphyseal aclasis. This is a non-neoplastic process, but the patient is usually symptomatic. So I would recommend orthopedic surgery referral for symptomatic treatment of the compressive symptoms of the lesions. Okay, this is the last case here. It's a very important one. As you can see here, there's a lesion arising from the bony exostosis. But this lesion developed malignant features. Okay, so that's why you should comment on if there is any evidence of destructive changes of the lesion or extraosseous soft tissue component. As you can see here is the extraosseous soft tissue component, and here is the destructive changes within the lesion. Okay, so how to comment? There is a large bony exostosis arising from the posterior cortex of the distal femur. The lesion shows destructive changes and large extraosseous of tissue component. The appearance is suggestive of secondary chondrosarcoma. Secondary chondrosarcoma, mostly on top of a previous osteochondroma. Mostly on top of a previous osteochondroma. I would recommend urgent. If you see any malignant lesion, I would recommend urgent orthopedic referral to guide care. Okay, so that's it. I hope you enjoy. And if you think my videos are helpful to you, please subscribe and like.